Hi everyone, it's Emily Bach. I'm a women's health nurse practitioner student at Regis College, and this is my pocket guide. This first slide is on the hepatitis recommended screening. So for hepatitis B, screening should be done on adolescents and adults that are at an increased risk of infection, and all pregnant women should be screened for hepatitis B at their first prenatal visit. And for hepatitis C, all adults ages 18 through 79 years old should be screened for hepatitis C. The hepatitis B screening recommendations is a little bit vague as far as adults and adolescents that are at increased risk. So this is a chart from the CDC with recommended screenings based on an individual's vaccination status. For the most part, I feel very comfortable in my knowledge with ovarian cysts as far as symptoms, risk factors, and treatments. The one thing that I wasn't super confident on was signs of an ovarian cyst being cancerous and when surgical intervention is needed. So that's what this slide discusses. More importantly, I wrote about the ultrasound findings that are concerning for malignancy, which are really if the cyst appears solid, nodular, or has thick septations. And then as far as size and menopause status are the big factors as well. And then if a cyst fails to resolve within a few months, increases in size, or if treatment methods fail to control symptoms, then a patient should have surgery. This slide discusses endometriosis in first, second, and third line treatments and when surgical laparoscopy is indicated for a patient and what the surgery should consist of. This slide discusses menopause and more specifically HRT. There's separate types of HRT that are FDA approved. Most importantly, there's bioidentical HRT, which is derived from plants and similar to the hormones in our bodies. So it would be estradiol, that's 17-beta, which comes in oral, transdermal, patch, and gel, and then vaginal cream, and then also microdosed progesterone that's only available in a pill form. Indications for HRT include vasomotor symptom control and then local HRT for vaginal atrophy. It's not recommended that HRT be used for prevention of heart disease, prevention of osteoporosis, or things like that. Same thing with dementia prevention. HRT is preferably prescribed for less than 5 years. And a woman with an intact uterus needs both estrogen and progesterone therapy. Contraindications include undiagnosed abnormal uterine bleeding, breast cancer, any tumor or cancer that's estrogen dependent, history of DVT, PE, stroke, or heart attack, active liver disease, or an allergy to any of the estrogen and progesterone products, and pregnancy. This is a nice slide on menopause HRT. It's a screenshot from the textbook that shows a breakdown of HRT candidates and treatment recommendations for patients who may not necessarily be candidates for HRT or if there's alternative, safer, better treatments available. This slide discusses infertility. So the definition is the inability to achieve pregnancy after 1 year of unprotected and frequent intercourse. Evaluation and treatment is indicated after 1 year of infertility in women under 35 years of age or after 6 months of infertility in women that are 35 years or older. Some special circumstances where a woman or partners may need expedited diagnostic evaluation and treatment is if the female partner is 35 years or older, she has a history of oligomenorrhea or amenorrhea, a history of tubal or uterine disease or endometriosis, or if the male partner is known to have subinfertility. This slide consists of breast cancer screening recommendations. I posted a chart of the various recommendations as far as the American Cancer Society, ACOG, the United States Preventative Service Task Force, and it gives the different breakdowns of the different ages and what's indicated a mammogram versus a clinical breast exam and when it's appropriate to stop screening. This slide is the breast cancer risk factors. I've included a chart from ACOG. I have a hard time remembering all the risk factors associated with breast cancer because there are so many. So this is a useful chart that I use to help study, and I wanted to include in my pocket guide. This is a slide on osteoporosis. It's the T-scores and what defines osteoporosis, osteopenia versus a normal bone scan. This is a slide on osteoporosis as well, but it's a chart from UpToDate regarding the treatment for osteoporosis, which I found very helpful when I was studying. I actually wrote about it in my discussion board post, and I wanted to include it in my pocket guide because I found it very helpful. This slide is on some causes of osteoporosis. More specifically, I wanted to include it because of the medications involved with osteoporosis. I had a hard time remembering that throughout the semester, so I think this is a very useful slide to include in my pocket guide because it also includes some medications as well as other risk factors for osteoporosis, so it's important when reviewing a patient's history. This slide discusses the diagnostic criteria for migraines with aura and without aura, and it includes the characteristics of migraines, which I thought was super helpful because sometimes it's hard to remember all the different factors in differentiating a migraine versus like a tension headache. So this slide does a really good breakdown of the different criteria for the diagnosis of migraines. This slide discusses the safest antidepressants in pregnancy and while breastfeeding. So in pregnancy, SSRIs including Zoloft, Prozac, Celexa, and Lexapro are all safe during pregnancy. Of course, the risk versus benefits should be weighed, but most importantly, Paxil should be avoided during pregnancy because it's associated with congenital cardiac defects. However, during breastfeeding, the recommended SSRIs are Zoloft and Paxil, actually. Here are the references that I used during this presentation. Some more references. Thank you so much for listening to my presentation. I hope you enjoyed it and learned some information.